Hey, young man, come closer and hear this. It's 7:30 a.m. in my clinic. A 26-year-old found a painless spot along the ridge of his glands 2 to 3 weeks after sex. Certain it's just soap. I'm Dr. Jame, your urologist and PhD researcher with more than 20 years at the bedside. I've helped men decode quiet genital clues before they steal time, confidence, and relationships. U.S. 2025 Data Q. Think of 1,000 cases and 80% are male. That means 80 out of every 1,000 need testing, treatment, and prevention right on time. Syphilis is rising in young men, and HIV co-infection shows up where risk clusters. CDC USPHS 2025 points to routine screening and prevention lanes, PP and PrEP, when risk is real, not imagined. Update those numbers at Publish. In this video, I'll walk you through 5 small penis signs that quietly hold the door open for HIV exposure, and I'll show the exact checkpoints and testing timeline so you stay calm and in control. If this matters to your prime years, subscribe, follow, and comment positive. And I'll give you a recovery plan you can actually use at home. Make it to the end for a practical secret. Have sex without dreading these symptoms. Feel charged, last longer, and raise desire. Simple and doable. If one sign already hit home, comment number 9 so I know you're moving forward, and add a small subscribe that pushes us toward our first 1,000. To close the HIV door, read the letter on your skin. 5 mistakes men ignore before we break down the symptoms. Let's go back to our patient. Robert, 26, sat across from me more than once during treatment. He told me, "Doc, I was too young, too uninformed, and that's why the symptoms got serious. I made big mistakes that made things worse." I asked him, "Are these the mistakes you're talking about?" Waiting for pain before seeing a doctor when a syphilis chancre is famously painless. Self-treating for weeks with creams or antibiotics, which smears the picture and hides the real cause. Assuming a sore that heals on its own means you're cured when it often slips into the latent stage. Ignoring painless groin nodes that quietly say your immune system is busy. Forgetting the 60-6-3 timeline for HIV and syphilis testing, so you miss the best windows to act. When I finished, Robert half laughed with his mouth open. "Doc, you just read my diary out loud. Comment 1 if you've made at least one of these. I want to walk this whole path with you, not just the first step. Now, take a deep breath. We'll move into the first crucial chapter. Read the letters written on your skin. Symptom number 1. Listen closely and stay calm. If you recognize any sign, remember, information is power and panic helps no one. You and I will start with the first clue, the painless syphilis chancre. Robert noticed it about 1 to 2 weeks after sex. When he came in, I explained what he was seeing. A small papule had evolved into a shallow, smooth-edged ulcer that didn't hurt at all. Typical locations are the glands, the coronal sulcus, or the shaft. Left alone, it often heals in 3 to 6 weeks, then misleads you. Why does this open the door to HIV? Because an ulcer is a break in the body's barrier. Friction during sex adds micro-tears, increasing tiny entry points and local inflammation that HIV can exploit. That's biology, not drama. Here's how to self-check safely. After a warm shower, use good light and a mirror to scan the glands, sulcus, shaft, and the frenulum. Gently roll the skin to look for a round or oval sore with clean borders and a red or pink base. If you find one, take a clear photo the same way each day. Write down the first day you noticed it and any changes over time. Avoid sexual activity until you've been examined. Here's what to do next. Book testing for syphilis and a full STI panel, and follow the HIV timeline. 4th generation test, and, when appropriate, RNA, on the 60-3 schedule your clinic uses. Early diagnosis means simple treatment and less uncertainty. A silent ulcer is a loudspeaker for risk. The danger is not the pain, but the illusion that no pain means no problem. Once you see the pattern, you can act with confidence. Comment 1 if you've ever seen a sore that healed on its own, and tell me how many days it lasted. If not, keep going. We're building your personal map of warning signs. When a chancre distracts you, the rash tells the truth, sometimes as itch, sting, or fissuring that follows friction. Listen up, my friend. Lean in for this one. A week after his first visit, Robert returned with a new problem: recurrent redness and scaling around the penis. This is the second sign we need to decode. A recurrent penile rash, mild itch, fine flaking, and tiny fissures that come back. Here's the recurring pattern I want you to watch. After sex, a sweaty gym session, or a long day in tight underwear, small red patches appear. They look harmless, itch just a little, then peel or crack along the sulcus and folds. They fade, then return, again and again. Why does this matter in syphilis? In the secondary stage, syphilis can produce a symmetric rash that's easy to confuse with fungus or simple dermatitis. Over-the-counter creams may calm the surface but not the cause, so the pattern keeps marching back. Why does this raise HIV risk? Chronic inflammation dries and splits the skin, and those microcracks lower your natural barrier. More inflammation means more immune traffic at the surface, exactly the scene HIV exploits. Here's how to take control. Start a small journal that links appearance to activity: sex, sweat, friction, or new products. Note day and time, what you did, and how long the rash lasted. Photograph the area in the same light after showers so you can compare. If the rash cycles back despite basic care, it's time to test. Syphilis panel plus HIV screening. Avoid long courses of steroid creams. They blur the picture and invite rebound. When creams keep losing, the culprit is often not the skin, but the spirochete behind it. Comment 2 if your rash returns after friction. If it feels too personal, just type, "Oh no," and I'll keep it discreet while still guiding you forward. Now, a simple question. What activity most often precedes the flare? Type it below, and we'll problem solve together. If your skin could send an email, Discharge and Odor would be the attachments. Let's move to symptom number 3 and unpack them properly. Now, we're at symptom number 3, young man. Discharge or unusual odor at the urethral opening. Robert had this too. He described a brief stinging and a smell that felt different. I told him to check hygienically. After urinating and washing hands, gently press along the urethra with clean tissue and notice any moisture or odor. Not glamorous, but honest signs matter. Here's the discrete pattern. There may be a light, clear, or slightly cloudy discharge first thing in the morning. A subtle odor may follow. The sting is brief and mild. Most of the time there is no pain, which is why men delay. Co-infections are common. Syphilis can travel with chlamydia or gonorrhea, causing a low-grade urethritis that flies under the radar. One infection can mask another, so partial treatment blurs the story instead of clarifying it. Why does this raise HIV risk? Smoldering inflammation recruits more target cells, think CCR5 and CXCR4, right to the surface. Local pH and the microbiome shift, and the mucosal barrier thins. That environment is easier for HIV to exploit during contact. Here's how to take control without panic. Schedule syphilis testing and add NAT for chlamydia and gonorrhea. Follow the HIV schedule your clinic uses, 4th-generation testing, and, when appropriate, RNA, on the 60-6-3 timeline. Avoid sex until results are back and you've been cleared or treated. If you're already on antibiotics, tell your provider exact names and dates so we don't chase ghosts. Self-check, done safely. Morning works best. After hand washing, place clean tissue at the meatus, press gently up the shaft and check for trace moisture or staining. Note color, odor, and time. No squeezing hard. Comfort first. Odor is the fog. Inflammation is the fire. Treat the fire, and the fog lifts. Comment 3 if discharge or odor has confused you even when your urine test looked normal. I'll support you discreetly and guide the next steps. If you're still here, you're beating the rush to judgment. Next, we'll pause for a mini hook and then move forward with focus. Thanks for staying with me. If this helped, comment useful and tap subscribe. Your support lets me keep bringing you practical, private guidance that actually works. Now let's continue to the next sign. Groin lymph nodes, the immune system's black box. Don't stop now. This sign is critical. Back to Robert. On his 4th visit, his face was pale. "Doc, help me," he whispered. "There's a lump in my groin." I examined him and explained the essentials. A groin node, one or both sides, firm, enlarged, and painless for more than 2 to 3 weeks often accompanies genital skin changes. When a primary chancre fades, the lymph node may keep telling the story. Why this links to syphilis? Primary syphilis commonly brings regional lymphadenopathy. That node is the neighborhood watch. It swells while the sore looks better, so men assume the danger is gone. Why this matters for HIV? Chronic inflammation activates lymph tissue, raises immune cell traffic, and weakens local defenses. That environment is easier for HIV to exploit during exposure. How to self-check with care. Stand in good light and gently palpate the inguinal triangle on each side. Note size, mobility, and tenderness. Repeat daily for 3 days and write it down. Compare both sides. If a node stays enlarged and painless, don't wait for it to speak louder. What to do next? Book an exam and test for syphilis and HIV together. Your clinician may add tests for other STIs or local infections. If treatment starts, keep a simple log, node size, day of antibiotics, and any skin changes, so we can see whether it's resolving. Silence in a lymph node is not peace. Painless can be a signal, not a comfort. Detect early and interrupt the chain. Comment 4 if you've ever felt a groin lump and then ignored it. If you've never had this sign, I'm glad. Stay alert anyway. Next comes the sign men dislike discussing because it feels like it steals their edge. When the immune system tires, desire often changes color. Young man, if you're under 40 and your desire is sliding, pause. That's the 5th sign I want you to know. Early drop in libido or ED in the setting of genital inflammation. Robert returned a 5th time. For almost a month he felt little to no desire. His circulation was fine, but firmness was off. He'd also cycled through a sore, a rash, and a groin node. Here's the picture I see in clinic. Men under 40 can still lose desire when systemic inflammation is active, especially in secondary syphilis. Fatigue, poor sleep, and stress amplify the slide and make erections inconsistent. Where HIV enters the story is behavior. Fear of testing leads to delay, and delay stacks risk. While you wait for certainty, exposures continue. What to do now? Screen for STIs including syphilis and HIV, optimize sleep and stress, and pause sex until you have clarity. If the labs are negative, we keep searching. Hormones, mood, meds, and lifestyle without shame or blame. When your body says slow down, don't turn up your ego. Turn up your awareness and your plan. Comment 5 if you've felt ED alongside inflammation. If this is you, breathe. There are multiple causes and we can map them out. Now we shift into the next step, the 3S rule you can use today. Before we enter the solution, let me share my simple 3S rule. A home routine that helps you spot warning signs early. Use it tonight and note what you find. See. Look. After a warm shower, check the glands, coronal sulcus, shaft, scrotum, and groin. Good light, a mirror, and steady hands. If you notice a sore or rash, take a clear photo the same way each time. Sense, feel. Pay attention to mild itch, a vague sting, dryness or tiny cracks, and any unusual odor. Write down when it appears and what preceded it. Sex, sweat, friction, new products, or long days in tight underwear. Scan. Act. If you have one sign plus recent exposure, book syphilis and full STI testing, and follow your clinic's HIV timeline, 4th generation, and when appropriate, RNA, on 66-3. Pause sex until you have answers and a plan. This isn't paranoia. It's a 60-second ritual that trades fear for facts. Comment "I'll do it" if you'll run all 3 steps tonight. I'll watch for your note and help you refine the routine. Now that you have a map, you need timing and the right medicine. Next up, the solution. The part you've been waiting for. Focus with me now. The important part is here. If you skim this, everything you watched may lose its power. Listen closely and keep this sequence. 72 hours after a high-risk exposure. Talk to a clinician about PEP. It's prescription only and time-sensitive, so speed matters more than bravado. At 6 weeks, get HIV 4th generation testing plus syphilis. At 60 days, retest and add HIV RNA if your clinician advises based on risk. If syphilis is confirmed, treat with penicillin G root, and dosing depend on stage. IM for most cases, IV if there's neurologic involvement. If you're penicillin allergic, your clinician will select a validated alternative. Safer sex while you heal. Use condoms plus lube to reduce friction micro-tears. Avoid sex when you have any ulcer, rash, or active discharge. That's not caution, that's strategy. UU mindset. If HIV is ever diagnosed, early treatment and adherence can lead to undetectable viral load, which means untransmittable to partners. That's science, and it's liberating. Bold promise. If you follow 60-6-3 plus C-Sense scan for 30 days, you'll exit the blind zone. You'll know your status, close the skin doorways, and take back control. At-home reveal. A 7-day post-sex recovery routine, sleep, nutrition, and gentle mucosal skincare can reduce rash-fissure recurrence, steady desire, and extend stamina. I'll detail it next in the daily 3-step routine. Set a 30-day reminder and comment "Done 30" when you finish. I'll cheer you on and help you adjust the plan. The framework is set. Now comes the everyday protocol. Let me show you the step-by-step routine to make this real. Observe the 60-second post-shower ritual. Stand in good light with a mirror and scan the glands, coronal sulcus, shaft, scrotum, and groin. Note any ulcer, rash, scaling, fissure, or swelling. Take one clear photo daily, same angle and distance to build a reliable record. Test. Match signals to labs on 60-6-3. Order syphilis testing plus NORAT for chlamydia and gonorrhea, CT/GC. Follow your clinic's HIV plan, 4th generation test, and, when appropriate, RNA on the 60-3 timeline. Pause sex until results are back and a plan is in place. Fortify. Raise immune momentum. Sleep 7 to 8 hours consistently. Eat protein-forward meals with iron, zinc, B-complex, and omega-3s. Hydrate well, cut back alcohol, and complete any STI treatment exactly as prescribed. Use condom plus lube when you resume sex to lower friction micro-tears. Recheck your skin 2 days after any new product or activity. Clinic visit or telelab. Comment your preference and I'll map a fast, discreet route with the right tests and timing. You now have a routine. Let's wrap it up so you can act today, not someday. Let's zoom out and trace Robert's path. Around week 2 after sex, he noticed a painless chancre at the coronal sulcus. He waited, and it healed in about 4 weeks. False reassurance. Soon after sweaty gym sessions, a light, symmetric rash returned along the sulcus and folds, with mild itch and fine flaking. 2 weeks later, he felt a firm, painless groin node that didn't go away. We tested. Syphilis positive on treponemal and non-treponemal labs. HIV negative on 4th-generation testing at 6 weeks, with RNA negative on the 60-day check. He received benzathine penicillin G intramuscularly per stage. Across follow-up, the node regressed, the skin cleared, and his confidence returned. Lesson: if you wait for pain or certainty, the door to HIV risk stays propped open. Detect early, treat early, close the door. Robert knew early and treated early. That's a win you can choose. Thank you for staying with me to the end. Here is your confident summary. 5 penile signs that point toward syphilis and why they matter for HIV risk. First, the painless chancre that heals in 3 to 6 weeks. It is silent, smooth, and easy to ignore, but it breaks your skin's defense and opens a door. Second, a recurrent rash around the penis. Mild itch, fine flaking, and tiny fissures after sex, sweat, or friction. It fades, then returns, because creams calm the surface while the cause persists. Third, light morning discharge or a subtle odor at the meatus with a brief sting. No pain most days, which is why men delay, but inflammation is still smoldering. Fourth, a firm, painless groin node that lingers for weeks. It's the immune system's black box, often speaking after the sore goes quiet. Fifth, an early drop in libido, or ED, in the setting of inflammation. Under 40, normal vessels but desire and firmness slip when systemic signals are loud. Tie it back to HIV. Ulcer plus inflammation equals a doorway. Early action, testing, and treatment closes it. If any sign rings a bell, pause sex, schedule testing, and follow the 66-3 timeline with your clinic. Use condoms plus lube until cleared, complete treatment as prescribed, and document skin changes with a quick photo journal. Remember my voice in your corner. I'm your doctor and PhD researcher, here to keep you safe. Knowledge beats fear, and a plan beats panic. Comment number 9 to mark your commitment to move forward. Subscribe for the 60-second checklist and the US 2025 data update when it's released. Share this with a friend who is stuck between fear and delay. Give him a steady hand and a path. Take what you've learned and act today. Small steps, see, sense, scan, lead to bigger wins. I'll be right here when you need the next move.